We're going to run old school with a PDF today, so I can see your faces instead of screen sharing in PowerPoint. But Jenna, do you want to start us off with asking folks to introduce themselves here?
Sure, and we're doing this in the chat, correct?
Yes.
Great, yes. So, well, first of all, I'm just super excited to be here today. Thank you so much. And I want to thank Annie, because Annie really spearheaded the creation of this session and then invited me to join her. And I by no means believe myself to be an expert in the area of naming the characteristics of white supremacy, but I do. I'm happy to be here as somebody 100% committed to racial equity and happy to share my story. So I look forward to seeing your introductions in the chat. So as you can see, the instructions are on the slide here. If you can just put your name and pronouns, the organization you're with, and then something that you're super passionate about in 6 words or less. And this can be anything. It doesn't have to be public health related. It could be what you like to do in the summertime or in the wintertime, or what kind of food you love. And that is the way we will hopefully get to know each other a little bit better. All right, awesome. And then Amy, did you want to say anything else about yourself before we dive right in?
You know, I am just really honored that all of you are choosing to spend this time with us. I'm really excited. So just in the sake of time, we'll keep moving through this, but do please introduce yourself in the chat, because it's really fun to get to know you all since we can't bump into each other in the hallway between sessions. So today we're going to be using a framework called the Characteristics of White Supremacy Culture to talk a little bit about how Jenna and I have seen white supremacy show up in the coalitions that we work in. I also am no expert in this, and this is not a framework I created. So please know that this has been created by really brilliant folks, and it's a tool that we found helpful. And so we're just here today as guides to kind of walk through this with you. Some of your guys' chat comments are making me hungry. I love it. So Jenna's going to introduce us to how we're going to be talking about white supremacy today.
Awesome. And I also was getting distracted with the chat and getting hungry. I realized I probably should have had a snack before the session. So there are a variety of definitions of white supremacy, and the one that we chose to use is that we're defining white supremacy as a system designed to set whiteness as the default for societal norms. And as the slide says, you know, these we're discussing these characteristics because they are damaging. And unfortunately, you know, I think that for many of us, and I guess I'll just speak for myself as a white person, you know, we've grown up in this society and with these cultural norms that are so embedded in whiteness that, you know, it's almost hard to identify what that looks like unless you have tools like the ones that have been created that are so helpful. And so what I think we've come to realize, especially over the last year, is that having this culture that has defaulted to whiteness for so long is damaging for our friends and our neighbors, our community members who are Black and Indigenous, Latinx, and Asian, and damaging for society as a whole, right? And you know, I really appreciated the former Senator Wellstone, who said we all do better when we all do better. And I feel like for me, like that's kind of at the crux of this. And so I look forward to diving into the characteristics here and then hearing your thoughts about how they show up even in your own world. So.
Perfect. So I'm going to walk us through these characteristics. And I want to be really respectful of the original work. So I hope you'll bear with me as I have notes, because I want to be really faithful to this. So one of the first ways that we see white supremacy culture show up is through perfectionism. And so I think that we all likely have either experienced this ourselves or seen it in others, but we see this as part of societal norms. So in addition to kind of this idea of everything having to be perfect or right, this can also show up as not expressing appreciation among people for the work that folks are doing. It can show up as talking more about inadequacies of people, what went wrong, than talking about opportunities for change. And we also see that it's often talking behind someone's back instead of talking with them. So saying, oh my gosh, so-and-so did this, instead of having a conversation. We also see that this is a way that we internalize that mistakes are a flaw of a person, rather than thinking they're a mistake that we all make, that this is just a part of how we experience the world as humans. And this also shows up as not investing time or money or energy into thinking about how things can be better. So instead of taking mistakes and using them to grow, we see it as, it can show up as kind of a sense of shame and not investing in doing better. Then we see a sense of urgency, and gosh, isn't this one that I have to pull myself back from all the time? So of course, there are urgent needs in the world, but sense of urgency as a characteristic of white supremacy shows up as a continued sense of urgency that encourages us to not take the time that is needed to be inclusive, to go through democratic processes or processes where all voices are heard in our decision-making, to not be thinking long-term, to constantly be in the short term rather than taking the time to think of what needs to happen in the long term. And it also happens in investing in quick, high-profile wins instead of the long, important work of creating relationships and trust within community that's needed for real transformational change. So if we think about defensiveness, a lot of defensiveness comes back to protecting power structures and people who are holding power as they are today. So when we see defensiveness show up as a characteristic of white supremacy, we see that criticism of people in power is often viewed as threatening or inappropriate. I think that's one that happens a lot, particularly in Minnesota, in the way that our white culture has kind of evolved here. We see that people who come with ideas, new ideas or challenges, are often seen as disruptors, or there's a negative connotation for it. And this defensiveness makes it really hard for us to raise new ideas that might be very worthwhile. And I think that the most important one for folks out there to think about is that defensiveness often leads to white people spending more time defending themselves or systems or groups against when they're called out for racism. It's defending themselves rather than taking the time to really reflect upon what is happening in that situation. We see quantity over quality. So this is both, of course, thinking of how can we do more, but it's also an idea of kind of an obsession with measurable goals. That if something isn't measurable, it is not worthwhile, or it's valued much more highly than something that isn't measurable. And so when we think of quantity over quality, it often shows up as having little or no value attached to processes and how those processes are happening. And it shows up that when there's a conflict between a process, so for example, an agenda for a meeting, and content, for example, real concerns about something that's happening, that the default in the system is that process wins of, oh, we're gonna run out of time, so we can't keep talking about that issue. We also see worship of the written word. So this is, if it's not in a memo, if it's not written down, it doesn't exist. And that when issues are raised, when conflict happens, when things are not going well, the default is to revert back to the written word. So, oh, well, that's not in the handbook, that's not in the policy. So we also see that this shows up in a way that in organizations and coalitions, oftentimes people with strong documentation and writing skills are perceived more highly and valued more than people who might have other very important skills. I think often this shows up valuing writing over relational skills. We've got only one right way. So this is the belief that there is one right way to do things. And this also shows up that when someone new comes into the system, there's a lot of times an unconscious belief of, we'll show them the right way we have figured out of doing something, right, in quotation marks, and then they'll understand. And if we show it to them and then they don't understand, then often it's, well, there's something wrong with them. why don't they understand the way that we do this? Or why don't they understand that this is the right way and we figured it out? We see paternalism, and I think that this is one that a lot of us can relate to in terms of understanding that this is those who hold more power, thinking they know what's best and making decisions for people who hold less power. But this also shows up in the ways that power moves in our coalitions and systems. So when paternalism is showing up, it can also show up in ways that it is unclear how decisions are made, that those processes don't make it clear how decisions are made. And it often shows up in the idea of folks who are most impacted by issues see very clearly how decisions impact them, but it's not clear the ways in which they can change those conditions. And so, gosh, I think a lot about a government in that last point, right? That how often do we have people who are so impacted by decisions that are made at every level of government, and yet how opaque can those systems be for change? Either or thinking. So this is an idea of things exist in a binary where things are good or bad, they're right or wrong. People are on our team and with us, or they're against us and they are not part of our group. And so when we click into this either or thinking through white supremacy, it often ends up making it really hard both to learn from our mistakes, because that was bad and it was universally bad and that's all it can be, or it makes it hard for us to move in spaces with healthy conflict. So if there's a right and a wrong, anybody who's bringing something up must be on that wrong side, is how this can show up in coalition spaces. This also shows up in simplifying really complex things. And so I bet if we all took some time to think of that, when there are complex problems and they're being simplified, that is one example of how either or thinking is showing up as white supremacy culture. Power hoarding, this is folks with power and privilege hoarding power. I think it's pretty self-explanatory. But one thing that underlines this idea of power hoarding is thinking of power as finite. So power is a pie, and if Jenna gets more power and more of the pie, I get less of it, right? Instead of viewing power as something that is shared, that is infinite, and that we can build together. So it's also important to note that those with power don't see themselves as hoarding power. I just want to let that one sit for a second, because I think for folks in this room who are in positionalities with power, it's really easy to say, well, I've seen that show up elsewhere. But to really think about the people who are engaging in power hoarding often don't think that that's what's happening. It also shows up, again, it kind of relates to paternalism, where people with power assume that they are making decisions in the best interest of other people and that this is the best way. They can make the best decision for other folks. Fear of open conflict. Whew, this is a tough one for some folks in Minnesota, I know. So this is folks in power being afraid of open conflict. Oftentimes people try to ignore conflict. They try to close the door so it can't happen. They view conflict as inherently negative instead of being something that can be productive. This also shows up around politeness, right? That there's a correct way to do it, or there's a polite way to do it. And if people are engaging in conflict in a way that's not polite, you can use that to dismiss the whole issue. So that's one way this shows up. It also shows up on blaming or scapegoating a person who is raising an issue instead of actually dealing with the issue at hand. Individualism. This shows up as competition being more highly valued than cooperation. It creates a lack of accountability because it's just about one person checking things off, and it's not about having responsibility to people that are kind of equal partners with you in a system, or, not necessarily. It's very hierarchical. And it ties really closely. Oh, I skipped one, or I think I got in the wrong order. We'll jump back. So as we think of progress as big or more, this is this constant growth mindset, right? That if we're doing more, if our organization or coalition is growing, if we're getting more money, that is inherently good. Instead of looking at the ways in which maybe as growth happens, that can lead to things like not having input from folks on the ground, to not serving constituencies at the level that you might want to. Objectivity, this is, and I think this is something that in a lot of our training as public health showed up, right? That there is, objectivity in this context is a belief that there is something as objective or neutral, right? That there are facts and there's everything else. And so this shows up as invalidating people who show emotion. This shows up as requiring people to think in a linear way, and that when people don't think in the way that we are expecting them to, or they don't reason with us or present their argument in the way that we want them to, we dismiss them as, well, they're not being objective. Right to comfort. This is that when folks with power, folks with power are in group settings, they feel that they have the right to comfort. And so when things come up that are challenging to them emotionally or psychologically, that things happen in a way that prioritize people with power and white people's right to comfort rather than dealing with the issues at hand. And I feel like I left out here, I'm sorry when I typed this up, the idea of I'm the only one, which relates to individualism, which is if something's going to get done, I've got to do it myself. And so Jenna and I both wanted to share a reflection on an experience when this has shown up in our working coalitions, but then we really want to spend time with you all thinking about how that has worked with you. So I'll just start. My example comes from the work I've done in tobacco control. I'm wearing my menthol shirt today because I'm over the moon about the FDA's decision to start the process of banning menthol tobacco. And it's well timed because my example today comes from my work in that space. So as during my time with the Minnesotans for a Smoke-Free Generation Coalition, we've done a lot of work around menthol tobacco. And we know that when new tobacco control policies are put in place, it's really important to accompany those with cessation tools, right? That we don't want to reduce access to tobacco and not give people the tools they need to help quit, because that's the outcome we're hoping for. And so I am recalling today a conversation where Black members of our coalition who are leaders in our menthol work raised the issue that the current system of cessation that is still and has been really based around helplines wasn't working for their community. And that's what they were hearing, that the folks who staffed the helpline were mostly white, and that was something that wasn't relatable necessarily for folks calling in, and that many people didn't love the idea of a helpline. They wanted in-person, in their community ways to access cessation. And the response that I recall, and this is only my recollection, but at that time, is that there was kind of a pushing back of, well, helplines are really efficient, they're evidence-based, and there are a lot of challenges with how we implement kind of community-based in-person cessation. And so when I think about how did that stand in the way of racial justice, well, we know that tobacco cessation, as it's happened, we've seen more and more people quit tobacco, that hasn't happened equally. And that Black folks, despite making more quit attempts, are less likely to be successful in quitting. And that we know that disproportionately Black folks still smoke more than white folks. So we know there are clear disparities. And I think today, looking back, it's really clear to me that if we want different outcomes, we need to do something differently. But in that moment, I don't think we showed up in a way that we might have wanted to if we were looking at it through this lens. So as ideas of what could go differently in this conversation, or different ways we could respond in the future using this lens, some things that our coalition and that white leadership in that time could have done is we could be more willing to get off our agenda and spend time really digging into the issue, saying whatever it was could wait, we could have more time. We could be acknowledging that coalition members and our Black leaders have different expertise and more expertise, that there isn't one right way of knowing or objectivity, and really acknowledging that. We could be more open with how decisions are made, right? Stepping away from paternalism and power hoarding. And then I think too, this just brings up, particularly for me as a white person moving in these spaces, always being mindful of not falling into defensiveness fear of conflict, and our own right to comfort in our response. That's something that I just, in all of these situations, try to be really mindful of how that bubbles up in myself. So Jenna, I feel like I've talked forever. Please tell me about your example.
Yeah, so I'll jump into my experience, and I know we only have less than 10 minutes left. And so, and like Annie mentioned, we really want to hear from all of you. And we initially thought we would have some reflection time and then some discussion after that reflection. But I kind of wonder if we just, after I share my experience, we just open it up to any kind of questions or reflections that you have after hearing these different characteristics, and then our experiences and naming some of those characteristics in our own in the coalitions that we've been involved with. So I'm going to just talk really briefly about the Minnesota Healthy Kids Coalition, and I will just start by saying, you know, this is in no way meaning to insult anybody who has been involved in that coalition, who was a founder of that coalition. I've been involved in the coalition for years. Blue Cross was a founder, and so. But I just think it's so important that we start naming these things and move forward with humility and with a commitment to change. And I do believe that we are there now with our coalition. And so, so we are a coalition that is comprised of mainstream public health and healthcare organizations. And the people who show up to the table are predominantly white, and then our focus of the coalition is really moving forward policies around healthy eating, active living, and tobacco. And so I really just wanted to name the characteristics of white supremacy that show up in really just the way we operate. And so our coalition does very little work together throughout the summer. We come together in the fall. We set our policy agenda, which is really driven by the mainstream healthcare and public health organizations. And a lot of those priorities are based on what national experts or organizations are saying. We move into the legislative session. We put a huge emphasis on lobbying and our legislative committee. We act with a sense of urgency throughout the legislative session. We get done, we celebrate any wins, and then we basically don't work together for the entire summer. And so I'll just name a couple of the characteristics of white supremacy that I have seen over the years. And that's paternalism, right? Assuming that we know what's best for communities that are experiencing health and racial inequities. And only one right way. Again, we've placed this overemphasis on lobbying and legislative work, and we don't do the work in between legislative sessions to really build relationship with leaders and with community members who are most disproportionately impacted by health and racial inequities. Quantity over quality. So again, you know, we focus so much on the way we've always done things, and we haven't really placed an emphasis on, you know, reflecting on our work and being willing to change the way that we do things, focusing on that how, as opposed to the what, the end game, the policy change. And then again, I already mentioned sense of urgency. So, you know, even during the legislative session, we might have some of these big questions that we're wrestling with in the lobbying or legislative committee, and we don't take the time to reach out to leaders of color, organizations who serve communities of color, to ask, because we don't have time, right? Sense of urgency, we don't have time to do that. And so I will say, again, the coalition, especially over the last year and a half, has really had some, you know, we've been having some challenging conversations, pushing ourselves, and we have been having some conversations with a consultant, Transformational Solutions, so Huda Ahmed, and then Ann Wiesner, who have created some recommendations for us. And one of those recommendations is really taking the steps to become an anti-racist coalition. And so, you know, that's where we're at now. You know, we're continuing to build upon those conversations and find a way forward, and all of our partners are committed. But I will stop there because I know we only have about 5 minutes left. And so, Annie, what do you think? Should we just open it up for any kind of conversation, questions, discussions?
Let's do it. Though I do want to say, in case we're pulled back quickly, please do take a moment. We have in our handouts a PDF, and there's a link on there. Take this framework, spend some time with it, because there are also anecdotes here. And so just want to make sure to say, please spend time with this document, because I think it'll be helpful. And now, yeah, we love questions, reflections, How is this resonating with you all?
So Jenna and Annie, this is Jaime. I wanted to thank you for your statements, and to say that having been one of those working in tobacco back in the 1990s, we were making the statements about tailoring projects and working differently with communities of color. And I don't mean this in a bad way, but I mean this in a way to show what happens in the environment. But it actually took some white people saying it rather than people of color having said it all along over the last 20 years. Mm-hmm. So I think that's the rub on in all this work. And then how do you re-steer it in a good way?
Could I just share a comment about how much we can learn from community-based primary healthcare approach that's used internationally, in particular, many countries that work at the village level. And I think in the US, we could learn so much about how do we truly turn over that power of decision-making at the micro community level, and to get out of the way of communities being able to determine what their priority needs are and what do they work on first in improving health in their community. And it may not be going in a direction where we think it should, but to trust them. They are the experts. They know what is needed. So how do we get out of the way?
Thank you. I'm seeing some questions in the chat. I'm hoping that you all can see the link I dropped. I'm wondering if chat is acting up a little bit here. So if not, if you just Google characteristics of white supremacy, or if you lose this link for later, Google it and it'll be right at the top. Also, thank you. That the comment around really transformatively changing where power lies is such a huge part of how we identify the way power moves and make needed changes.
I can't send to everyone in the chat, but I just wanted to mention something for nonprofits, that grant makers and foundations need to be educated in this, because a lot of times you have to have a plan, you have to have a short timeline, you have to have outcomes, measurable outcomes, that doesn't always fit with the framework that you're talking about.
100% agree. 100%. Yeah. And I think that's even in the coalition work, some of the challenge, right? Because organizations will say, well, we don't have funding to do that work, right? So there are real resource needs and questions, which, like you said, boils up to some of those funders. So I totally agree with that.
And related to what Kathleen said, the whole issue of recognizing practice-based evidence versus evidence-based practice, because there hasn't been a lot of collection of data and documented for many communities.
Absolutely.
Absolutely, Jamie. Yeah. I know we're about to get moved into the next session, but any last comments? Again, I want to thank you, Jamie, so much for helping us through this session, and thank you again to Annie and to all of you for joining us. And I will say too, if anybody has any follow-up questions or comments, feel free to email me or Annie.